Okay, so this afternoon we're going to discuss this very short topic in our lesson, which is the interprofessional education. And we're going to discuss why uh, this course is very important to be integrated in basically in the curriculum of the allied medical professions. So in to 2010, the World Health Organizations uh, create a framework for interprofessional education and for collaborative practice. Now, here it is being emphasized by the World Health Organizations that interprofessional education occurs when students from two or more professions, so let's say from other professions or other courses, learn about from in which with with each other to enable effective collaborative and improve health outcomes. So the WHO um, emphasized that uh, two allied health profession must have a they must three or more or no more much better that the allied profession must have an interprofessional education because interprofessional education here plays a very important role in improving the health of the client or the consumer. No? Because by collaborative uh, treatment or by collaborative management that is applied to your client, of course, will always result to better outcomes. And also by this, uh, the two professions or the two or three more professions learn from each other and they will learn to appreciate each other's um, uh, professions. So not only that they will have a good outcome, but also it creates a more ethical manner on how to deal with each profession. So as a student, interprofessional education must be applied, no? And then interprofessional education is necessary steps in preparing collaborative practice, ready health workforce that is better prepared to respond to local health needs. So here it is being emphasized by the it's very emphasized by the WHO that it is very important for what preparatory, no? Preparatory uh, aspect of the students when they become professionals. So that they learn now how to work collaboratively. So in a management team, they will learn now how to adjust or to adjust with other professions. They will learn how to be sensitive with them. No? So it is very important, no, interprofessional education. Collaborative practice happens when multiple health workers from different professional backgrounds work together with patients, families, carers, and communities to deliver the highest quality of care. So this is the main target. Means collaborative practice is applied because we need to have a highest quality of care that will be obtained by the patients. So in this means that if we are already working, know how to work collaboratively, collaboratively as a student, then when you become professional, it is very easy for you now to work with other professions. No? For the main purpose nga uh, to give highest quality care for your patients. So remember that our treatment should be patient centered, not therapist centered. No? So inana siya. So ang focus na to is dapat sa pasyente. So that's why importante gyud kaayo ni ang interprofessional education. No? Yeah, next. Okay, so IPE or interprofessional education is a very important component of primary healthcare. Uh, Now, various health professional education programs throughout the world have attempted to introduce IPE in their curricula. The philosophical argument here is very clear that IPE at the pre-licensure level will lead to improved interprofessional collaboration in practice and ultimately improve health outcomes for patients. So this is the main goal of why pre-licensure level is IPE at pre-licensure level is introduced, no, para ma-improve ang interprofessional collaboration. So collaboration does not only exist in research but as well as in patient handling, no, in academic and educations, no. So inana. Yes. Okay. Thank you. Okay. Um, so this is very important, no, to our profession, the IPE. Actually, it is now being introduced in the curricula, although it is not, there's no course or specific course that intend to address these needs. But, okay, but you can easily identify this, no, in our sectioning. If you notice that the ET, the MedTech, the ND, and the RadTech are being grouped, no, in one sections. In there, you will see that they are now, no, in their activities, they are grouped differently or mixed. They are in mixed grouping. Why? Because not only that, because uh, you are small in numbers, that's why you are being grouped with others so that you will become a one section. But at the same time, here, unknowingly, your interprofessional uh, relationship with other courses is being developed. No? Um, so you are grouped in mix, or in some activities you are grouped in mix, then you'll be asked to present it. So here, RadTech, MedTech, ND, and other PT are working together harmoniously, in one group. So you will learn how to deal with this profession. So when you go, or when you are already a professional, you will no longer have a hard time in relating to their workforce because you have now a better understanding of their profession. But of course, there are some nga dili pud siya pwede, no? Let's take for example, when it comes to a professional subject, no? Dili pa pud pwede nga emerge mo sa dito sa nursing care nga nga course, no? Kay nurse man to, specified man yun to. Let's take for example in histopathology. No, di pwede nga i-mix dito, no? Although you have general pathology sa medtech, no? Kay lahi man pud to, kay specific naman to sa ilaha sa medtech, no? But of course, mostly sa general education, mga subjects, you are being merged with other courses, basically to develop this interprofessional education. Okay, so the challenge now to educators is to work together to cross disciplinary boundaries and overcome institutional barriers in order to design, implement, and evaluate shared learning experience at the pre-licensure level in order to prepare our students with the requisite knowledge, attitude, skills required to enter professional collaboration and practice. So this is the challenge now. The challenge now is for the teacher to how how would the teacher approach these mixed courses in one section that he could relate to all these courses. No? Makarelate siya direkta sa hindi, makarelate siya sa medtech, sa PT, sa radtech, no? Kani yung mga kurso or sa nursing. So, ang challenge sana is sa teacher kung saan niya pag-cross the boundaries so that the students or her students can work cooperatively or collaboratively with the activities that is assigned to them. So, ano siya importante kaayo. So, as this now, may inyo nasabtan. So, later on, um, inyo po nang ma-integrate na sa inyo, no? Mao dayto no nganong gibutang mo sa mga inani nga kurso nga nagisagol mi kay inani day ang purpose, no, not only that because we are small in numbers, so there are other reasons that maybe when you are still in lower years you'll be having questions why you are being mixed with other professions, but the main purpose of this is this one. Okay, so the challenges in interprofessional education. So this is the challenge now, lack of research support in educational program in NPE. So this is very true, not only in our schools but in other schools. Actually, in other schools, kay tungod sa kadaghan sa ilang estudyante, so wala na siya mix-mix, no, separate yun na siya. So here, the students are being asked to work on sa kung pa isa courses is nag-ija-ija o nag-aho-aho ang PT, ang medtech, ang indi, ang naa sa School of Medicine, no, nag-iya-iya sila lihok. Oh, so wala ay kwan. So pag abot sa professional na nila, medyo maglisod sila relate, no? So kay patasan na lang og pride. So manang advantage nato compared nga to sa ilahan, no? Lack of coordinations between competency and certification requirements, resource limitations, including faculty and financial resources. Of course, ano siya limitations yun, kay simply you will hire now faculty that will address this and you will need to send them to a special training so that he could or she could work with this kind of environment, no? Mix ang iyang group. And of course, administrative barriers and faculty resistance. So sometimes faculty will be resistant, no? Even administration will be resistant in doing so this. No? Ibutang na siya nga mag-offer pag course nga inani. So that's why ang uban ang isa nilang ka-technique. So ato na lang ni sila ubanon sa isa ka course, no, sa education, general education. So probably sa PE isa lang sila o sa pang mga course Bible subjects or whatever. So ang faculty na po resistance kay nga naman when it comes to her course, let's take for example Bible. So how would you integrate these courses together to work cooperatively? How they were going to relate each other? Alang pa Bible study ho nimo ang hindi sa PT or PT sa hindi. So muna siya ang barriers, no, because again it requires special training in order for the faculty to adapt with this kind of educations, no, interprofessional educations. So financially wise, the administration would not do that because it's an additional training, it's an additional expenses. Okay. So benefits of IPE. So this is the benefits, no? When you're allied, when your team now works collaboratively. So what happens to the output of the team? Of course, no, optimize health services. Your health system will be strengthened, no? Sa imong pan di ka problema kay nga naman. Uy, Ang pagkabalo sa nurse nga, ay kani siya nga problema is, oh, this is very kwan. Kinahanglan ni siya ipapiti. So automatically she would suggest only to the doctor, Dok, pwede ba nato ni siya ipapiti? I-refer nato kay anan, diba? So of course, kung ang doctor is also learn how to work collaboratively with other medical allied professions, no? I-refer niya kay nga naman, okay, that's good suggestion, no? And at the same time, with pag-abot sa PT, pwede siya ganyan, oh, I think this needs an imaging also. I-refer na ko ni sa Radtech. Oh, see? Or hindi. So, not only that the patient receive optimal health services, income-wise, you are generating income within also, di ba? Interdepartmental, because once you refer him to this department, ubayad man ang imong client dito. And your system also will be strengthened. Means you have a workflow that to follow, no? Then you have also improved health outcomes. Of course, makita na nin nato dayon nga ang the professionals or the team will not be working hard, or they will not be burned out because the work now is divided and it is being addressed by the right person. No? Nana siya. Of course, ang patient, mas satisfied ko siya kaya ang health outcomes niya is very good. Now, these are the barriers. So, usually, there is a breakdown, no? Muna siya. Supposedly, unta nga, connect unta to ang imong kwan. So, pag-refer dito, na iban nga barrier pa na siya kaya ng prejudice na sa dayon, no? So, understanding its profession rules and responsibilities. So, usahay mo, dili masabdan nila ang roles sa professions o responsibilities, why it is being referred to them. So, mo pinasahi og trabaho, no? So, mo na ilang paminaw nga, tapulan man na nga kung department nga nung sigig paso sa ato nila. So, inana. So, these are barriers. Scope of practice, of course, inana will be questioned why you are doing that. Ano sa mga doctor, o sa nurse, o sa ka. So, of course, that can be avoided if the scope of or the job description is known by the individual. No? So, kung kabalo sa yung job description, these barriers, especially in scope of practice, this can be avoided. Difficulties of delivering IPE in higher education. So, this is the basic, no? Sa eskwelahan, muna. Traditional workplace hierarchy of top-down approach. The collaborative IPE challenges these values and beliefs in order to change the culture. So, this is the main barrier halos gid nato. Because of the hierarchy, nga naanda nato nga top-down, gikan sa taas dapat ang order, o gikan dili diri gikan sa ubos, pasaka. So basically, ang main nimo nga issue that you'll encounter is the captain of the ship, which is the doctor, no? When it comes to health professionals. Okay, sila may captain of the ship, no? Diba? Sa ethics, sila ay doctor, sila ay attending doctor. So for them, they are the one responsible, so they are the one deciding on what to do with the patients, so if it is good or not. In which malimit na to ang improvements sa services nga gihatag nato sa patient. Then you have your interprofessional feedback process across different profession and skills mix. Skilled instructor feedback is required to maintain trust and inquiry in safe environment. So kani siya feedback, no? Sometimes medyo mo ni kulang nato kay nga naman maulaw ta mahadlok ta maghatag og feedback ngadto sa other professions, because some might get angry or mad or indifferent with our profession kay murag correct ra gud ka it kuno ta, or mao gyapon ang atong stand pud sa pikas, no, di ba? Na profession. So na dili ta open minded, no? Resources to deliver quality stimulation, both technical and non-technical skill training. So this is the lacking also. No, wala kay laboratory nga kung asa ni siya ma-apply. Supposedly ang training unta inana ang simulation ta sa laboratory would be like that, no, nga all allied health professions will be involved in one patient, so that the laboratory should be a collaborative. Pero instead of doing that, no, notice na to, wala pag yung inana, no, in any courses here in the Philippines, there's no such collaborative approach pa nga ginahimo sa lab. Laboratory pa lang. Let's take for example, na patient karon tagaan siya isa ka case. So nursing ra gina dito na sila mag-return demo sa ila, rep them sa ilaha nga lab. Unta pwede ra man siya nga, okay, mag-redeem siya karon, okay, we have a stroke patients, so we'll make a case presentation. So nursing will present the case in nursing kwan, okay, then of course there will be PT also, there will be medtech, there will be what, no, each i-practice nga mag-uban tanan nga professions. So here makita na to ang collaborative work sa student pre-licensure, no? So at the same time here, when question raised to the patient or to the students with regards to the case of the patient, if that question is intended, no, di magin malikayan, sometimes we'll be asking questions questions that are not related to PT. Yeah, ito siya related siya sa INDI. Let's take for example, if we're going to ask skin assessment, dryness, unsay cause ana niya. So ikaw PT, unsay nimo pag-answer, may dehydrated siya. Kung dehydrated siya, unsa may imong kuan, so moadto na dayon ko sa water dosage. Of course, kita sa PT kabalutan nga dapat 8 to 10. So about ikaw na say sakit sa heart ni, na siya enlargement sa heart, okay ba ni nga inaning amount sa water yung imnon? So asa man nato na i-refer nato siya sa ND or i-refer nato siya sa nurses, because they are the one responsible for carrying out the orders of the doctor regarding to fluid intake. No? And also diri sa ND kung sakto ba na siya nga unsa may nutritional component ana nga kulang nga makaresult sa dryness sa skin. So see? So those questions will be addressed by other professions. And ikaw nga PT, you will understand, inana din na. Okay? So, mag-abot ka dito, kung dili na siya ma-apply sa professional mo level, na ay problema nga ma-encounter ana, you will know how to do, and you may suggest it to the nurses or to the MD or to the patient directly. So, inana. Learning from mistakes and shared learning in the no blame culture of healthcare. So, inana siya. So, supposedly, these are barriers nga naman. Sa ato, nandan lahi man. Because once there is a mistake, we will look for somebody who have mistake and you will blame that one instead of helping that one, that individual, to how to correct the mistakes and guide that individual that these mistakes will not happen again. So, instead of blaming her. So, ang ato lahi man. Ato siyang i-blame, and later na to nato siya tabangan kundi na ganyan makaya. So this is the essential components for IPE. So Steven et al. In 2017 identified these essential components from IPE or Interprofessional Education Program. So knowledge for practice. Okay. So ang kahibalo nimo sa imuhang professions. Skills for practice. How skillful are you with your professions? Sunod, ethical approach, which is very difficult to approach an individual ethically when you are in collaborative practice. Second, professionalism. How professional are you in taking up criticism and at the same time taking up critics? Makurikan ba ka o dili ka makurikayan? So, these are essential. So, dapat kanun i-take na to ang bahalag negative pa na nga critic, we will take it constructively, no? Second, continuing professional development, CPD, patient-centered approach. So here, remember this always, that our main goal is to provide quality healthcare for patient, not for doctors, not for nurses, not for PTs, not for indies. It should be patient-centered ang atong approach. And teamwork skills that we should work as a team, not as individual. Okay? So, inana. So, if you find mistakes with other professions, you go with him, talk to him about this ethically, and then help that professions or professional on how to solve this problem. Kaysa iyaman na ang field. Okay. So, inana, dili kay ato siyang dauton dito sa patient kami tahana magin ang mga nurses mga bagay di ano no, we will not do that, diba? That's the ethical way, unethical way rather. So these are the references, no, that I use in this lecture, of course, from also from your textbook, no. Okay, so thank you for listening. So it is just a very short lecture, about 25 to 30 minutes. I hope also those reporters, only one yet one individual passed the reports now with the video, so I cannot integrate all this video unless the two of you, no, kay tulungan mo ang last nga reporter sa grupo, will pass your own report, no, kay di ba ang ingon man nato nga integrate to ni sir ay ha nako i-upload dito sa ato ang module. So unsa na ako pag-integrate nga isa pa man kabukang nagpasa, no, sa ilahang recorded reporting. So please pass your recorded reporting. Okay, thank you and good afternoon.